I was 45 years old and I have the widowmaker heart attack and I almost die. And so, even today when I'm treating patients, it's personal. We need orthodontists to become doctors. I've been taught to take out 4 bicuspids and just make it straight. And, I thought that was the right thing.
Yeah.
Most orthodontists out there that are straightening teeth, taking out teeth, and lining teeth are tooth technicians. The kids that I expanded, the parents would come back to me and they would say, hey, you did that expander and my kid, they used to snore and they don't snore. And so I started looking at it and saying, well, what if I expand this kid that doesn't have a crossbite just because I don't want to take out teeth? It wasn't any airway thing. It was just, man, I did not like doing the extraction. Now, some of these parents are like, hey, since you did that expander, just in a month, my kid quit bedwetting. And I was like, man, there's got to be something to this. The youngest I've treated kids is 2.5 years old. Everybody says sleep apnea is your tongue's going back there and blocking the airway. Nobody looks at the nasal passage. The key to sleep apnea is not worrying as much about the tongue, it's worrying about getting that nasal passage opened. When you expand that maxilla and the nasal passage opens up and that pathway of airflow is just smooth, what happens is that patient can now breathe through their nose, and if their tongue is sitting up and forward in their palate, then they have a seal and they've got a free-flowing passage of air. Upper airway resistance syndrome is in pretty much almost all of the little kids that we're treating. That's why they're struggling. And I always look at it and say, that's stage 1 cancer. And I look in their mouth, and this is a humbling experience to look in there and say, you know what? I took out 4 teeth on you. I didn't cause your sleep apnea. The orthodontics didn't cause it. You had it before.
Thank you.
What I did is I didn't help it at all. And I think that the general dentists that are doing the airway stuff are taking over and we're treating the root cause of this.
Yes.
We need to become doctors of our patients. We need to be treating the patient, not the symptom of the crooked and crowded teeth. She is like a big part of what changed my life, this little gal right here. So blessed that we've been able to help her out. The mission in life is really to improve everybody else's quality of life.